Yeah, well, thank you, Mr. Chairman. And obviously, when you look at what we opened with, the mandates have been thrown out by courts over and over again. We've had three different court cases on mandates. All three have said that the president doesn't have the legal authority to fire people, whether it's federal workers, subcontractors, or healthcare workers. Yet it seems like that's the administration's main focus. I think if you go to Mr. McCarry's opening statement, I think you touched on some things that a lot of us would like to see explore more. I've talked to a lot of medical professionals that have said it seems like that the Biden administration is really underplaying the importance of things like natural immunity, of some of the other therapeutics that are out there. And we've had, obviously we mourn the lives of the hundreds of thousands of Americans who have died, but we also know that we've had millions of Americans who have contracted COVID and then came through it and lived. Some had really, really tough experiences. Some had very mild symptoms. That, by the way, is before and after the vaccine. Vaccinated and unvaccinated people have gotten COVID, who have experienced different degrees of difficulty going through it. And again, some that have had no problems, but they've tested positive and now they have immunities. And it seems like there is a missing gap in the science on what these immunities do, how it protects people going forward. I think you touched on it with children, but if you could, Dr. McCarry, talk about what maybe Congress should be looking at more. What should the scientific community in Washington be doing that it's not doing to study more about what natural immunity really means? If you could unmute.
Thank you, Ranking Member Scalise. You raise a really important point because the original sin of this COVID pandemic was that when this virus hit the United States, we had a complete paralysis of research at the NIH. With over $42 billion, they could not pivot any of those dollars quickly to answer the most basic questions that the American people were asking all of us in healthcare. How does it spread? Do masks work? How long do I need to quarantine for? When is the peak day of viral shedding in the course of illness? We could not answer those questions with any solid evidence because the NIH was unable to pivot their funding. We just did a study of NIH funding last year, the year of the pandemic. They spent 5% of their budget last year on COVID research. They spent twice as much on aging research. The average time for them to give research dollars to a group of researchers like my team was 5 months in a health emergency. They had 278 research grants on social determinants of health, an important topic, but about 4 on how the virus spreads. And so you had this very popular groupthink led by our top public health officials that it was surface transmission, wash your hands for 20 seconds, pour a gallon of alcohol gel on your grocery bag. We had a vacuum of scientific data, and what filled that vacuum is political opinions. That is the original sin of this politicalization. It was the inability of the bureaucracy of the NIH to pivot their funding to answer the practical clinical questions that we needed answered. And today, we can't do this. We seem unable to do any follow-up on the therapeutics, fluvoxamine, budesonide, hypertonic saline spray. I mean, none of these things have gotten the research dollars to this day. We've basically been uni-focused on vaccines, an important intervention, but it's come at a heavy exclusion. So when we talk about helping the world, we're not doing them a service if we're only telling them about one of several important ways to reduce death and mortality.
Well, I appreciate that. And clearly, as we continue to promote the vaccine and its safety, and effectiveness, again, the president only talking about mandating vaccines or else somebody's going to get fired. The courts aren't even allowing that. So at some point, you would think the president would move on and come up with other alternatives, including natural immunity, which many medical professionals are starting to look into and recognizing that there's a dearth of study being done to show just how that helps keep people safe. All of this focus should be on helping keep people safe, not only one size fits all approach. Let me finally ask you about schools. We've seen a lot of studies that have shown kids ought to be in school and it actually hurts them not to be. Have you seen any research on that as well?
Brown University has a good study showing that kids who have been in school during the pandemic compared to kids who've been in school before the pandemic have more cognitive, motor, and learning deficits. This is a tragedy. It's uncharted territory. We're going to appreciate the downside of this far into the future. Young women have had a 51% increase in emergency room visits for self-inflicted harm. And so the list goes on and on. Substance abuse, opioid deaths are up 330,000 this year. So anyway, that is the American tragedy.
But we'll try to get that Brown study to all the members. And I appreciate that feedback. With that, Mr. Chairman, yield back.